Hi everyone, my name is Ali Egana, and my research proposal was over the effects of blood flow restriction on the muscles and the strength of collegiate athletes. So, a little bit of background on blood flow restriction. It uses a tourniquet cuff and a personalized tourniquet system to partially occlude the limb, and then you perform low-intensity resistance training exercise while it's occluded. So, these tourniquet systems can actually calculate the person's limb occlusion pressure. It's pretty small. It looks like a blood pressure reader, one of the automatic readers, and you can find their limb occlusion pressure and then set it to maintain a certain percent of this value throughout their treatment. So it's always adjusting to their movements and their what their body's doing to maintain that pressure, so you don't get the spikes that you might with just something like wrapped around their leg. So typically in these blood flow restriction treatments like this, you can restrict it anywhere from 40 to 80% of their limb occlusion pressure. And then the resistance training exercises that you're doing are anywhere from 20 to 30% of their 1 rep max. Some of the things that you would start with in these kind of treatments would be straight leg raises, squats, leg curls, knee extension, sometimes monster walks, and other basically any lower body exercise that you would do unoccluded, you can do with blood flow restriction. So some of the uses for this are to prevent atrophy, such as right after someone has surgery when they can't really do any sort of resistance training, or they might be non-weight bearing. You can use this to help prevent atrophy because it's making their muscle work a lot harder than they would just in their every day-to-day lives. You can also use it to induce muscle hypertrophy instead of heavy resistance training. And then some studies have started using it to help improve vascular function. One of the main things that I've seen is treatment in Parkinson's symptoms. But that's a little different from what I'm looking at. So this kind of therapy induces the same type of metabolic stress as heavy resistance training without the same type of damage to their joint, their surrounding tissue, everything like that. It's very appealing for athletes who either just had surgery, like I talked about earlier. They aren't able to do all of their normal day-to-day activities, like they might not even be walking. That typically you see a very big decrease in their strength just because they can't use their muscle in anything besides their therapy sessions. And so blood flow restriction helps to make those work harder than you typically would be able to let them, because you're not causing as much stress on the joint. And then you can start inducing hypertrophy before they would be able to go back to that level of resistance training. And then another big use that I've seen is in people who have chronic conditions within their joints that limit their resistance training abilities, such as people who have like chondromalacia or other inflammatory conditions. Normal heavy resistance training really starts to flare those things up pretty quickly, and so they might be really limited in the weight room. But if they're doing extra sessions of blood flow restriction, it can help them induce hypertrophy in a way that is more comfortable and safer for their joint that's already got some problems going on with it. And it's not quite clear how these physiological effects of blood flow restriction impact the muscular strength immediately after. And so my study is looking to investigate this, specifically to investigate the effects that blood flow restriction has on muscular strength immediately after a treatment session, and to see how long it takes for that to go back to normal. So I would be using collegiate athletes for this study. They would have no lower body injuries currently going on. Preferably I would have an equal mix of male and females and of different sports, just to give a good variety of people in the study. And then for the study itself, we would start with baseline testing. We would use isokinetic testing of both legs. We'd be looking at peak torque for knee flexion and knee extension. After we have all of their baseline testing recorded, we would do a blood flow restriction session in their non-dominant leg, and then we would do isokinetic testing immediately after, 1 hour, and 4 hours after the treatment session. We do this on both legs to be able, that way we can kind of account for the fatigue that occurs just from the repeated isokinetic testing, and that way we can see what's really from the blood flow restriction and what's just from the protocol. We'll compare this to their baseline data and look for the presence and magnitude of any strength deficits that might occur. So this will highlight any strength deficits induced by blood flow restriction, like I just said. We know that there is minimal fiber or tissue damage, but it's very taxing on the anaerobic power systems. So I expect to see a decrease in the strength, followed by a steady increase back to baseline as they are recovering from this. It's not quite clear how soon the strength will return to baseline. That's one of the main things that I want to see in the study. And it's not very clear whether this deficit will be enough to affect an athlete's ability to protect themselves. That's another thing that we'll be looking at. So typically after an injury, when we're looking to return someone back into activity, we want them to be at 80% or more of their baseline test or of their uninvolved side, so that they can fully go through all of the movements in their sport and be able to protect themselves throughout. So this could really change the way that clinicians use this with their athletes. There's not really any guidelines out there right now about what you should do in order to incorporate this into an athlete who is already doing things. A lot of the research is out there about how it helps them post-surgical and when they're doing very specific treatments and only those treatments throughout that day. So this would really give us the startings of guidelines for timing this with other workouts, and can help prevent injury in these patients that are using it to help induce hypertrophy while keeping their chronic condition calmed down within this joint. It'll be very helpful with that group, that patient population, and be able to let them use this in their day while still safely going about the rest of their training, so that it'll help prevent people from being injured just because they went straight from blood flow restriction into a different workout because we didn't know that there really was a strength deficit. This would be the groundwork for starting those kind of guidelines and protocols of how to incorporate this in those patients. There's not really a whole lot out there yet about that. So here are my sources, and thank you for listening to my presentation.